health, sport, and physical activity. The 2014 edition of Australian's Health states, "Health is not just the presence or absence of illness or injury, but incorporates dimensions of physical, mental, and social well-being. Understanding the health issues that face Australia is fundamental to prevention and a healthy future. The national health priority areas are diseases and conditions that Australian governments have chosen for focused attention because they contribute significantly to the burden of illness and injury in the Australian community. These include cancer control, cardiovascular health, injury, mental health, diabetes, asthma, arthritis and musculoskeletal conditions, obesity and dementia. While these are all significant and important to the lives of Australians, some relate more to Australian youth than others. Mental health, diabetes and obesity are three health issues that impact the youth of Australia specifically. It is not only important to recognise this in order to educate children correctly about healthy lifestyles, but to reverse or minimise the detrimental effects that these illnesses can have on children's futures if they continue to carry their unhealthy habits through their lives. Mental health is a state of emotional and social well-being. It is noted that the impact of mental illness on individuals' health and well-being has been underestimated until recently. Mental illness has damaging effects on individuals, families and carers, and even society as a whole. The 2007 National Survey of Mental Health and Wellbeing measured the prevalence estimates of mental disorders. The survey found that 45% of Australians aged 16 to 85 years had at some point in their lifetime experienced a mental disorder. Women experienced higher rates of mental disorders than men. Men were more than twice as likely as women to have symptoms of substance use disorders. And young adults aged 16 to 24 had highest prevalence rates of mental disorder, which could be linked to high rates of substance abuse. Suicide is the main cause of premature deaths among people with a mental illness. An overview of suicide in Australia is as follows. More than 10% of people with a mental illness die by suicide within the first 10 years of diagnosis, and 15 to 24 is the age group with the highest rates of suicide. Socio-cultural factors that can cause mental health problems in Australian youth are family disharmony or changes in family values, redefining of the typical family structure, peer expectations, media stereotypes, cultural and religious expectations, and racist and discriminatory attitudes. Socioeconomic causes include high rates of unemployment and low levels of education. Environmental determinants of mental health include geographical location, remoteness leading to social isolation, and lack of access to health services and access to latest technology. The effects of mental illness on Australian youth include a strain on family relationships and relationships in general, leading to social isolation, missing school days and an increase in behavioural problems and eventually dropping out of school, a drop in grades, and alcohol and drug abuse. Obesity is an important health issue in Australia and around the world. It reflects abnormal or excessive fat accumulation in the body that can present significant risk to health. It generally occurs when more energy is consumed through eating and drinking than is expended through physical activity. Childhood obesity is a major concern that puts children at risk of poor physical health in the short term and of developing many chronic diseases later in life. According to the Australian Institute of Health and Welfare, 25% of Australian children are overweight or obese. 63% of Australian adults are overweight or obese. Indigenous young people aged 15 to 24 years were more likely to be overweight or obese than non-Indigenous young people, and in general, rates of overweight and obesity increase with age. Studies have shown that once children become obese, they are more likely to stay obese into adulthood. Obesity increases the risk of many other chronic and potentially lethal diseases. There were 215 deaths registered in 2009 where obesity was identified as the underlying cause of death. In total, there were 1,043 deaths for which obesity was either the underlying cause or an associated cause of death. Of those deaths where obesity was an underlying cause, 51.6% were male and 48.4% were female. Socio-cultural factors that can cause obesity in Australian youth are family eating and exercise patterns, family disharmony, peer rejection, genetic factors, religious beliefs towards exercise, and cultural attitudes towards food intake. Socioeconomic causes include a low level of health education and negative school environments. Environmental determinants of obesity in Australian youth include geographical location, low access to health services, and a lack of availability of the latest medical treatments. The effects of obesity include early development or risk factors for coronary heart disease, including raised blood pressure, cholesterol, and blood sugar levels, respiratory problems such as asthma, social isolation due to bullying, the development of mental illnesses such as depression, and the major long-term consequence of childhood obesity is its continuation into adulthood. Diabetes is generally characterized as the inability to break down and use sugar. This disease can have a significant impact on quality of life and can reduce life expectancy. All types of diabetes are complex and require daily care and management. The incidence of diabetes in Australia has increased significantly over the past 20 years. In 2007 to 2008, 4.1% of the Australian population reported that they had medically diagnosed diabetes. Aboriginal and Torres Strait Islander peoples have one of the highest prevalence rates of type 2 diabetes in the world. People with diabetes experience reduced life expectancy. Diabetes can contribute to coronary heart disease, stroke, and vascular disease. And finally, diabetes was the sixth leading cause of death in Australia in 2011, contributing to 10% of all deaths. Sociocultural factors that can cause diabetes in youth are as follows. Indigenous Australians are more at risk compared to other Australians due to less education about the risk factors and less access to medical services. Having a Pacific Island, Indian, or Chinese cultural background puts one at risk of diabetes. People with family history of diabetes are also at risk. Australian incidence of type 1 diabetes among those aged 0 to 14 years is one of the highest among other countries, due to the general Australian diet being high in saturated fat and sugar. Socioeconomic causes include low socioeconomic status and those who are less educated being more at risk, as they are more likely to consume high levels of alcohol, be physically inactive, and consume diets high in fat and sugar. Environmental determinant. A greater access to technology has led to higher levels of inactivity and therefore a risk of diabetes. The effects of diabetes on Australian youth include the development of associated health issues such as heart disease, the development of high blood pressure, high cholesterol levels, and a lack of blood glucose control, a lack of concentration, and lifelong changes to health and physical activity routines. Physical activity is commonly understood to be beneficial to everyone's health and well-being. However, it is important to understand the vital role that physical activity plays in the lives of young people. Ultimately, physical activity, when introduced and supported at a young age, enables children to develop healthy habits and sustain them through adolescence and into adulthood. The World Health Organization explains that regular physical activity of moderate intensity, such as walking, cycling, or participating in sports, has significant benefits for health. Furthermore, regular and adequate levels of physical activity improves muscular and cardiorespiratory fitness, improves bone and functional health, reduces the risk of hypertension, coronary heart disease, stroke, and diabetes, is fundamental to weight control. Although there is numerous physical benefits that derive from physical activity, it is important to note the social, emotional, and mental health benefits from participating in physical activity from a young age. These benefits include reducing antisocial behaviour, building quality of life, building mental well-being, and lowering risks of depression and other mental health issues. The World Health Organization recommends that children aged 5 to 17 years should participate in at least 60 minutes of moderate to vigorous intensity physical activity daily, and should include activities that strengthen muscle and bone at least 3 times per week. Health-promoting schools take a holistic approach to the promotion of health, where there is a clear coherence between the school's policies and practices. The World Health Organization states that a healthy promoting school can be characterized as a school constantly strengthening its capacity as a healthy setting for living, learning, and working. There are many plans that schools can put into action to promote and encourage not only physical activity but healthy lifestyles. Some strategies used by schools include a healthy canteen. Eliminating unhealthy options available for purchase at school is a significant way to promote healthy eating. Fruit break or piece of fruit for lunch policy. This is another method to encourage children to make healthy choices. Involving movement into classroom activities. Classrooms that incorporate activity within their learning environment and learning materials will increase activity time of the students. Incorporating information about healthy lifestyle into classroom lessons, for example, using fruits and vegetables to learn mathematics skills. Sporting opportunities. Providing opportunities for students to participate in organised sports is a significant way to get children active. And communicate with parents. It's fundamental that schools introduce and adopt multifaceted programs and strategies in order to improve the health status of today's youth. But for this to stick, there needs to be a dialogue between school communities and parents. Ultimately, parental behaviour is associated with child and adolescent habits, so the behaviours of parents should be taken into account. Parents should be strongly encouraged to give the right example, especially where fat and energy intake are concerned. This is also important to take into consideration when setting examples of physical activity. Health is not just the presence or absence of illness or injury, but incorporates dimensions of physical, mental, and social well-being. This well-being can start at home or in the classroom, but in order to be effective and reduce the possibility of disease and illness such as mental illness, obesity, and diabetes, it needs to be reinforced and positively incorporated into the lives of Australian youth. These young people are the future of Australian health, and in order to make this future one filled with happy, healthy, and connected individuals, we need to work together to promote health and physical activity.